Good morning. Hi, everyone. Welcome. We're so glad that you've come this morning. We appreciate your spending your Saturday morning on a Mother's Day weekend with us to learn more about mental health and our services here in Cobb County. On behalf of the Cobb and Douglas Counties Behavioral Health Work Group, I welcome you to the New Horizons Mental Health Morning. My name is Vicki Harkins, and I teach mental health nursing here at KSU. I'm a new member to the work group, and I'm so pleased to have the chance to work with some absolutely wonderful people who are very, very interested and devoted in these topics and in providing care for our citizens. Today, in these two sessions, we will cover mental health resources and cultural competency and mental health stigma. We'll hear from our wonderful four speakers, and at the end, you'll have an opportunity to ask questions. If you would like to ask questions, just stand. We'll bring the mic to you, or there's some cards at the end of some of the tables, and you're welcome to write your questions down, and our timekeeper in the back will take them, those questions, and bring them to us. Each speaker will have 10 minutes, and then we will have time for questions at the end. We will repeat this again at 10:45. If you want to hear it again, you're welcome to stay. If you have other questions that you'd like to ask after the second time we do it, we would be glad to answer those as well. As we talked about before, when we're finished, we do have a questionnaire that basically asks about access to mental health services in Cobb County. We welcome you to fill that out. There will also be a course evaluation in this room where you had some food, and we welcome you to fill that out upon the completion of the program. And then out here, we have several vendors who have come to educate us as well about the services that they provide for our clients. Our first speaker will be Foster Norman. Mr. Norman is the CEO for the Cobb County Community Services Board, and he will be speaking to us about mental health resources in Cobb County. Thanks, Foster.
Thank you. Good morning. Glad to see all of you today. Hope this will work for me. So I have a little PowerPoint, and I'm glad there's a clock on the wall so I can see my time, because this is probably more than a 10-minute presentation, but I'll try to condense it, so I'll be going through some things that maybe you might see some written statements on the slides that I may not address. First of all, how many of you in your room have heard of the Cobb County Community Services Board? If you have, raise your hand. So, wow, a good number of individuals. And you that raised your hand, how many of you think you know what we do? Only one out of that group? Okay, well that's fine. And that's pretty good, because most groups I speak to, when I ask, have you heard of us, most people have not. But then those that have, when I ask, do you know what we do, the response is about the same. I usually get maybe one or two people that do. So real quickly, the Cobb County Community Services Board, that term, Community Services Board, is a term that's in Georgia statute. So we are a part of the Georgia Community Services Board system, and there are about 24 or 25 community service boards across the state. And we are a legal entity, we are a public entity. No, we're not a state agency, we're not a county agency, we're not a 501c3 nonprofit. We are a community services board, public entity. And most of our funding is tax dollars, which either comes from the Georgia Department of Behavioral Health and Developmental Disabilities, or it comes from the county, or it comes through fee-for-service, such as Medicaid or Medicare. So these are some of the things you probably already know, but just to go through a couple of these on this slide, we know that in any given year there's about 44 million Americans that experience a mental illness. We also know that there's about 10 million of those that are experiencing a serious mental illness. We also know that suicide is the 10th leading cause of death, second leading cause of death, those ages 10 to 34. And something, yesterday I went to the Cobb County Veterans Court graduation, if you know about the Veterans Court in Cobb County. But there are about 20 veterans that die every day by suicide. And serious mental illness costs our country about $193 billion in lost earnings each year. Sorry, too many buttons. So our agency has an annual operating budget of about $25 million. We have about 320 staff. We have a number of locations across the county. And our purpose really is to provide the safety net to individuals who have a mental illness or who have an addictive disease or who have an intellectual and or other developmental disability. And when I say safety net, what I mean by that is that we are that agency that if individuals do not have the means to pay for those services, in other words, they are uninsured and they don't have a job where they make a lot of money, where they can go and shell out $100 to a therapist or a couple hundred to a psychiatrist, and or they may be underinsured, because we know that there are a number of individuals who may have signed up for a health plan through the Affordable Care Act and whose income is low, thus the federal government pays their subsidy of their premium each month, but someone forgot to tell them that when they go to the doctor that they have to pay a copay. And so then they walk in the door and they say, yeah, I've got insurance. But then when they're told, okay, well, you got a $25 or $30 or $40 or $50 copay, they say, well, I really can't afford that. So that's an example of an underinsured individual. And in some cases, you might as well even say that they don't have insurance at all if they can't afford the copay. So we are that safety net provider. So I usually ask if someone has a physical health issue and doesn't have insurance and doesn't have the means to pay for it, where do they go?
Emergency room.
Emergency room. When someone has a mental illness and needs to seek care and don't have insurance and can't afford to pay for it, where do they go?
They don't know.
They don't know, and there's another answer, the same one you gave, emergency room. So I'm here partly, I think, to tell you that Cobb County Community Services Board is that resource in this county for those individuals. Whether it's a routine issue or whether it is an urgent issue or whether the individual is in crisis. So we provide an array of services, including outpatient, some intensive outpatient, day programs, residential programs, and crisis programs. And our Behavioral Health Crisis Center, you may or may not have heard of it. It's located really 2 buildings down from our outpatient clinic on County Services Parkway. And this crisis center is open 24 hours a day, 7 days a week. People can walk in. Family members can bring folks. You don't have to have an appointment. Law enforcement bring folks to us. As well as, you might think this is odd, but in our outpatient clinic, if someone is new to us, in fact, we don't even make appointments. Now, why do you think that may be?
Yeah, it's willing to tell anybody.
And for individuals who have a mental illness or a substance use issue, if they've gotten to the point where they have realized, I need to seek help, well, you need to give them that help right now, because if you wait, then they've changed their mind again. And back to, well, there's no one out there really that can help me, or there's no one that will help me. So we want to say to folks, we will help you. And what we say to a new time caller is walk in. Here's where we are. Just walk in. Can you come this afternoon? No, but I got transportation. I can come in the morning. Fine, come on in. So when the folks walk in, then we do that assessment, initial assessment, to determine what services that they need. And if someone needs some ongoing therapy, then that first appointment will be provided to them within 3 to 5 days. If the individual needs to see a psychiatrist for medication evaluation, then our attempt is to get folks seen in that first appointment within 7 days of that initial assessment. And I think we're doing pretty good right now with the 3 to 5 days for the therapy. 1 minute, sorry. That's how you get into our services. Let's see if there's anything else that I want to say real quick. Yeah, let me go to the last page. So Georgia has a crisis line. This is statewide. It's the Georgia Access and Crisis Line. It is an 800 number. You can call that crisis line. We also have local numbers. The top number is we have an access center, and then the crisis center has their own number. And if anyone ever you run into someone who says that group didn't help me at all, you can call me, and we'll figure out why, and then we'll figure out how to get help. So I guess my time's up.